Good morning, everybody. Last time we talked about the movement of the eyeball and the muscles that move the eyeball, the focus, the vision for us, how to strengthen those. But today we are going to talk about and focus upon the muscles that control the eyelids, the movement of the tears from the eyes into the nose, and the facial features that the eyes provide. And that is very helpful. We see the end point many a time in our practice when we see the droopy lids, which requires surgery to fix them. We see the eyelids drooping down or drooping, or they turn into the toward the eyeball, so the eyelashes start rubbing against the eye. That sometimes will cause irritation, sometimes infection, and at times it will require surgical repairs to solve the problem. So many of these issues can be delayed or avoided if we are aware of the muscles that work these things, the eyelids, and how to prevent them. So today we will be doing the work on the muscles that close the eyelids, open the eyelids, and tend to decrease some swelling that occurs around the eyelids with age. So, having known as to what we are working on, visualization of that area, paying attention to that area, and trying to assimilate breath with the exercise that we are doing, that is additional bonus to the muscles. So, let's start. So, the first exercise we will do today is called palming, ancient exercise in which then what we do is we close our eyes and take two full breaths. Breathe in, and the mind is concentrating on the eyes. Breathe out, breathe in, full abdominal, then chest exercise, still focusing on the eyeballs, and breathe out. Rub your hands together, generate some heat, and apply the palms on the eyeballs with gentle pressure around the orbit. Enjoy the calmness, the quietness, the darkness, and the peace that is coming to you through your breathing. Breathe in, breathe out. Keep your eyes closed. Rub the hand one more time. Generate that heat, and you're transferring that heat to the eyeball, which provide the comfort and the soothing feeling to the eyes. Breathe in, focusing on the eyeballs, eyelids. Breathe out. Today we'll do it just 2 times, but one can do it up to 5 times. We take certain things for granted. Blinking is one of them. Nature has produced tears for us, a different mixture of water, mucus, oil is coming onto the eyeball surface. The idea is to paint the cornea or the front window of the eye with those tears. Upper lids, when they come down, they pick up some of that tear, and when they go up, they paint a layer of what we call as tear film on the cornea. It stays intact for a few seconds and then it starts dissipating, and then we blink again and we paint the cornea again with the tear film. But when we do a lot of computer work, very interesting computer work, screen time, get an interesting book to read, our blinking rate goes down. And if that goes down, the tear film tends to break up and we are not aware. So the surface of the cornea tends to get some dry spots which become irritable, ends up in a dry eye syndrome. So let's consciously blink and again trying to include breath with it, and we'll blink for 30 seconds, then take a break. Breathe in, breathe out, and we blink 30 times, 3. Count in your mind and keep breathing normal. Okay, take a break, close your eyes, take a deep breath, breathe in, breathe out, and we'll repeat that cycle for 30 times again. Your attention is on the eyelids that are doing the work. If I'm off here and there with a few seconds or a few times, just please excuse me, but you count to 30 and then we stop, close the eyes, inhale, exhale. So that was the normal blinking that the orbicularis muscle that helps do, but we need to strengthen it. So we will do a little hard work on this muscle by squeezing the eye. So there are certain eye conditions like glaucoma, because when we squeeze the eye, it actually is squeezing the eyeball, and the squeezing of the eyeball increases the pressure inside the eyeball, and we do not want that in patients who have glaucoma or certain other conditions that may get disturbed by the squeezing. But by and large, we can all do that. So same way, we will close our eyes, inhale, exhale, and we squeeze the eye gently. We don't have to squeeze the eyeball out of the socket, but we just squeeze them 20 times. You can attach that with the breath by inhaling and squeezing out the breath while you squeeze the eye. 10, 11, 12, 13, 14. I'm squeezing the the core muscles with the squeezing motion of the eyelid. So today again, we'll do this cycle twice so we can stop, close the eyes, relax, enjoy that bliss. So this was the exercise for the orbicularis oculi muscle. But now, with age, again, the eyelids sometimes will tend to droop. So there are two muscles, one a very minor muscle, but the major muscle called the levator, because it elevates the eyelid. It is hooked into the eyelid and comes from the behind the eyeball attached to a bone. So when that muscle contracts, it pulls the lid up. So generally when we blink, we do lift the eye up, but usually we stay up to the midline. But this time we will consciously lift, keep your eyebrow stable, forehead stable, just the eyelid. Look down, look up as far as your eye will go without moving the head. Down, up. We'll do it 10 times. Down, up, down, up, down, up. 4 more times. Down, up. Okay. Take a break. Close your eyes. We repeat that cycle one more time, which you can do on your own. The next level we will take it to, we'll add some resistance to this levator muscle by putting our index fingers just below the eyebrows, and we'll do the same thing. But this time the levator will be working against slight resistance. Look down, look up. The eyelid will be putting that resistance, but we still look up as far high as you can. And we'll do it only once for practice. Down, up, down, up, down, up. Paying full attention to that muscle that is trying to work against the resistance. 8, 9, 10. We also notice that drooping of the eyelids is not completely by weakening of the levator muscles. Our forehead muscles, that also tend to get weak, and the whole forehead eyebrow segment starts drooping, and it pulls the lid with it or adds extra weight to the eyelids, so the eyelid becomes smaller in some patients as they get older. So this time, when we look up, we will include lifting of the eyebrow and the forehead as well. So look down. We'll do it 10 times, and we'll do it only once, but you get an idea how many times to practice. About 5 times practice is always good. And again, remember to keep visualizing the muscles that are working and try to connect that with the inhaling and exhaling. That adds extra benefits. So we look down and look up like we did before, but this time we go one notch higher by raising the eyebrow, maybe furrowing the forehead, hold it. 1, 2, 3, 4, 5. We go down, keep the head stable, look down as low as you can, look up, look high, all the more, as far as you can. Hold it. 1, 2, 3, 4, 5. We'll do it one more time, but one can do a cycle of 5. Look down, look straight, look up, all the way up with the levator. Now lift the eyebrows, and now include the forehead muscles. 1, 2, 3, 4, 5. So these are some of the muscles that have worked. We have tears in our eyes that we may know or we may not know, those who are not in the medical field. They are drained into the nose. And there is a beautiful draining system nature has created for us. Lower lid, just about near the inner corner, as well as the upper lid, has a small hole. And that hole is connected to a tube that goes toward the nose. It opens up into a bag-like structure like this. We call it lacrimal sac. Then that sac is connected through a tube that goes into the lower part of the nose. And when we blink or squeeze, we are squeezing that sac, which pumps the tears it has collected into the nose through that one-way valve. And when we open the eyes, that sac relaxes and it expands. It sucks the tears from the eyeball through that little tube that we have, or tubes that we have, into the sac. And this cycle goes on during our waking hours. Sometimes people who get facial palsy, paralysis of that nerve. The lid droops, but the blinking mechanism stops the draining mechanism of the tears also. So watering is pretty common in those people. So again, when we were doing the squeezing and the blinking, we were utilizing that to squeeze the lacrimal sac as well. So it was helping promote the tears from the eye into the nose. You know that when we are emotional or get something in our eye, the eyes produce extra tears. Our nose runs, and now you will know why it does, because that is the end point where the tears go. So these are some of the exercises that we do, but having done that, we need to relax them. And some of the fluid that sometimes builds up around under the eyelids. So by gently rubbing the eyebrows outwards and the lower part of the orbit, squeeze it outwards. So some of the fluid that has built up as we are sleeping and gravity has not yet pulled it away from us. So it eliminates some of that. Sometimes there's fat herniation under the skin. That we cannot, but any extra fluid that is built up, that will be helped. So you rub the eyes, the upper orbital rim, the lower rim, the lower eyelid outwards. And then we tap the forehead. That relaxes and brings extra blood circulation to the area that we tap. And again, link that with your breath as you go. Take in a deep breath and just tap on the forehead, on the eyebrow, on the temples, on the lower lids. On the temples, on the forehead, on the eyebrows, and feel that relaxation descending upon this whole area that we just worked on. And just you close your eyes and you can say your mantra the way you like it. And it's somewhat an easier way to slide into meditation if you wish. Om. Thank you.